Hello and welcome to today's webinar. Before we get started, I would like to remind you of a few things. This webinar is being recorded and a link will be provided to the recording shortly after today's date. It will also be put on our website for on-demand viewing. You will also be sent a certificate of participation for spending time with us today. If you have any questions as we go through the webinar today, we will be taking questions and answers at the end. You just simply type your question into the chat feature and we will be alerted to your question and we will answer them at the end of the webinar. So again, welcome to today's webinar on new tools for your EMT Teacher Toolkit. Now, why did we choose to grow our product line in the EMT market? Well, employment of emergency medical technicians, EMTs, and paramedics is projected to grow 7% from 2018 to 2028, faster than average for all participants or all occupations. This is also a market we have seen grow in the past few years, especially at the high school level, as we strive to fill the skills gap for this in-demand occupational area. Everywhere you look, there's a shortage of EMTs. We can help by providing more resources for EMT instructors who need to train more students. Here are just a few of the product categories that we have some new and exciting products for our EMT product line this year. We've got BLS and cardiac care, airway and breathing, trauma care, vital signs, pharmacological interventions, moulage, injections, soft skills, and at the end, we also have several pathway packages that we're going to share with you today. So for BLS and cardiac care, we have two brand new products, but some oldies but goodies we've had for quite a bit are also in our line. They are our adult nursing Manikin, our choking baby, and our CPR baby. Now, just a reminder that our adult Manikin performs CPR and it provides real-time feedback on compression, depth, and rate. It also does over a dozen nursing procedures, so you can get a lot of mileage out of this one Manikin. Our choking and CPR infants provide important hands-on practice for these vital life-saving skills. And all of these trainers come with curricula. So here we are with our pediatric nursing Manikin. Now we know that pediatric patients differ from adult patients and have unique needs in some care procedures. So we know some students can sometimes be intimidated by the thought of caring for a child. So this Manikin will help your students overcome any apprehensions they might have before they need to deal with it on the job. Now this medium fidelity nursing Manikin is the size of a 3-year-old pediatric patient. And it includes CPR as a feature and again provides that real-time feedback on compression rate and depth from the AHA guidelines using our proprietary feedback device. And you can see the list of all of the different nursing procedures that you can practice using hands-on with our pediatric nursing Manikin. Now, by providing over 8 hours of content, this will save instructors time as it's ready to use and ready to go. So we have many different modules that you can go into to get content, ready to use content for using with the nursing Manikin. And here's just a list of some of the things that come with it in addition to the curriculum. Now the next thing we have to share is an AED trainer. Now we know that our students need to be able to safely learn to perform AED or that automated external defibrillation. And safety is key with this product. You can use it without the risk of that high tension shock defibrillation. And this will also safely simulate AED working procedures in the emergency field. Defibrillation can be intimidating to learn as a skill because you are shocking someone who's actually flatlined. By practicing the skill over and over in a safe manner with the simulator, it can help students become more confident. Sometimes students forget what they learn in the heat of the moment and the anxiety emergency situations can present. So instructors can use the 9 built-in scenarios in the software to simulate different scenarios of emergency situations to help students build that muscle memory. This AED simulator is a versatile tool because it can be used with any adult Manikin as well as a person. So more use in the classroom means it's worth more money more than just that single-use task trainer. You can get a lot of use out of this one trainer. It's suitable for, that basic life support. It's easy to operate. You simply turn it on and there you go. Again, safety without the high tension shock, those built-in 9 scenarios. It also has trouble simulation functions that you can also use on the controller to simulate when things go wrong, like wrong pad position, low battery, etc. Again, this can be used with any adult Manikin. It also does come with pediatric pads as well. Our airway intubation trainer provides hands-on practice with endotracheal intubation techniques. Warning sounds happen if the tube is misplaced or if excessive force is used on the teeth during the procedure. Now we have a new airway suction trainer as well. A few situations in medicine are more high stakes than management of the unstable airway. Failure to protect a patient's airway can result in life-threatening compromise in a matter of minutes. So for EMS providers, few situations are more technically challenging than managing the unstable airways in this dynamic, sometimes dimly lit confined spaces frequently encountered in pre-hospital settings. So, and I think instructors tend to like tools that teach many things. And this task trainer does 2 things. It does suctioning and insertion practice on 3 different techniques. It does oral, nasal, and trach suctioning techniques. This trainer can also be used to practice the insertion of suction catheters into the nasal cavity, the oral cavity, and the tracheostomy site. Removable side and transparent plates give students a window into the airway and the anatomy during suctioning procedures for better understanding. Now, there are competitive events that are huge for HOSA programs, and a tool like this can be used to train students for HOSA competitive events on suctioning skills. Suctioning is a skill that EMTs must show mastery of for certification. So this can help their EMT students prepare for that skills certification test as well. For trauma care, we have a whole suite of products to discuss, including immobilization products as well as bleeding control products. Now, most students will not have the chance to palpate, manipulate, and immobilize closed fractures prior to experience in the field. This Manikin provides the special opportunity to experience just this in a controlled manner. Once they feel what that break is like without breaking the skin, they will definitely remember it. Unique in the market as far as trauma Manikins go, it has closed fractures in the Manikin bones that can be identified, palpated, and immobilized. Instructors prefer a tool, again, that can do many things. And this does, you can see a whole list of over a dozen care procedures that you can also do on our closed trauma fracture Manikin. It also includes slings, splints, braces, and bandages for easy practice in a variety of trauma scenarios. Students will get hands-on practice perfecting many of these skills. It also includes 5 different lessons in the curricula. No other trauma Manikin in the market has over 5 hours of content bundled with it. Now, here are some of the things the package includes. Pajamas, it has the 4 wounds, the jaw trauma wound. It has the closed fractures that you see on the screen, but it also comes with those splints, slings, braces, and bandages. So all of that combined, there's also a quick start guide that will help teachers learn how to use it quickly and be able to use it in their classroom immediately. In addition to that, we have a brand new Splints and Braces supply pack. And we know that all EMT programs need these types of supplies in order to practice those basic skills. And we wanted to make it convenient to purchase everything you need from one source. So this package enables you instructors to be able to do many opportunities for splinting and bracing in all types of situations, creating emergency response scenarios. There's enough supplies for entire classes to participate, making classroom management much easier. Students will not be standing around waiting for their turn, but they'll all be actively participating. And this supply pack works very, very well with the closed fracture Manikin that we just shared. All EMT programs need spine boards in order to practice supine immobilization, which is a basic skill. We wanted to make it convenient to purchase everything you need from one source. So practicing spinal immobilization is a skill needed for certification. And the EMT National Standard Curriculum publishes a list of recommended supplies, and these include backboards and spine immobilization devices such as this. The spider strap system is also considered the ultimate inpatient immobilization because of the 10 points of attachment. It securely and easily straps from the shoulder to the foot area and it will make the patient unable to move on that spine board, which is exactly what you want. So it's just a very easy, convenient way to provide hands-on practice for your student on the skills they're going to need in the field. Students cannot experience bleeding and hemorrhage control with real patients until they're on the job. Yet they need to learn these skills and show mastery to become certified. They need a tool like this that simulates amputation in order to practice key bleeding control techniques in a controlled environment. This trainer simulates the upper limb amputation and practice of traumatic limb hemostasis. Hemostasis is the process of slowing and stopping the flow of blood to initiate wound healing. Pressing the brachial artery running area can produce hemostasis. There are many skills associated with bleeding control, and this skills trainer addresses many of them, including practice cleaning, disinfection, compression hemostasis, and bandaging techniques. This trainer provides real-time feedback to students. When a tourniquet is applied correctly, the bleeding will cease. If not correct, bleeding will continue. It will be obvious to them whether they have done it right or wrong. Bleeding can intensify emergency situations. So this is the type of tool that's ideal for training staff to prepare them to manage trauma, stabilization, and being able to handle the sight of blood. Handling a bleeding trauma emergency scenario is difficult enough, of course, but trying to communicate with the patient or family members in addition to stopping the bleed is even harder and more difficult. So we wanted to bring a unique simulator to the market that teaches both at once. Now we've seen the power of wearable simulators in our other products, and we wanted to take that approach into this market as well. So this will help your students walk in the shoes of a bleeding trauma patient as well as the emergency services provider. It's a wearable simulation suit, so you're teaching those soft skills such as patient communication. And this is difficult to do in an emergency situation. So by providing students a chance to practice, they become very familiar with this when they're out in the field. And this wearable trauma wound suit is a proprietary product to Realityworks. So some of the suit features include the fact that it's got 4 built-in wounds, 3 that bleed, 1 that doesn't, and they pack it and they use tourniquets and other things on it. The one size fits most wearable trauma suit also can be easily cleaned after use. It can be used on real people like standard patients or students, or even on mannequins. And we've also provided some additional add-on wounds that you can use in addition that can be adhered or put onto the suit for additional skills practice. Our award-winning blood pressure simulator is an excellent tool for learning how to read many kinds of blood pressures. The software provides random, independent practice, as well as the ability for instructors to program specific readings for assessment purposes. It can be used on mannequins or on real people as desired. Now, we wanted to provide tools that are needed for basic skills practice that every program needs, that convenient one-stop shopping. So that's why we have the Stethoscope class pack. We offer competitive pricing on stethoscopes, and having it available in quantities of 10 can help you more easily outfit an entire class. It's a dual head stethoscope, so you'll be able to listen to different ranges of sounds based on patient conditions and ages. So good quality stethoscope available in quantities of 10. Now the chances of EMTs experiencing a coronary events are very high. About every 25 seconds, someone in America will have a coronary event. Every minute, someone dies from one. The EMT role is to recognize that possible acute myocardial infarction patient, alerting the receiving facility early, not delaying scene time, initiating treatment promptly, obtaining and transmitting that 12 lead for physician review. So accurate lead placement, we know, is just everything when getting a proper ECG. This may be used as a standalone lead placement trainer to give immediate real-time feedback on the accuracy, placing 3, 4, 5, and 12 lead placements, or it also has standard ECG rhythms that EMTs need to know. And our proprietary software can be used for student practice identifying those 16 standard ECG rhythms. And while practice makes perfect, the software can provide you with practice and an assessment mode. So you could set this up in a skills lab for that independent practice. Instructors would not need to be present. Students could just practice until they learn to recognize them. Now we know students need to also be able to recognize rhythms digitally on screen and also in print. So you also get a set of workbooks and rhythm identification flashcards that give students the practice identifying these in print. Errors are common for the ECG novice, so our curriculum addresses methods for mitigating and recognizing commonly read errors so students can definitely learn from their mistakes. Students can use our ECG Simulator to prepare for domains 2 and 3 of the Certified EKG Technician exam. You can also purchase additional workbooks and rhythm identification cards on our website as well. Now we're going to talk about a couple of unique pharmacological intervention products that we have available for you. The first one is our Epinephrine Training Kit. And we know anaphylaxis is a sudden onset, systematic allergic reaction that can cause rapid death if not immediately identified and treated. The universal standard treatment is the administration of epinephrine. So we want to help EMTs be prepared to act swiftly and confidently in these situations. So this package is put together in a special way to help make classroom management easier. We've included multiple reusable trainers and consumables. So 10 students can simultaneously practice at once. So there are several different ways to administer epinephrine. We wanted to expose students to all of these methods so that in emergency situations, they know how to perform the method that best works for the situation at hand. The curriculum and kit include information and supplies for doing all 3 ways. Our supply pack is an easy, convenient way to also replenish supplies at an affordable price. So it includes 10 EpiPen trainers, which are reusable, 10 injection packs, syringes and vials and things like that. We also have our large injection pads. You can be doing intramuscular injections as well. So everything you need to teach your students safely how to do multiple ways for epinephrine administration. We also include a Naloxone Training Kit. Now we know that the fatal opioid overdoses in the United States are at epidemic levels. In many areas, the EMS system remains the only source for pre-hospital naloxone access. We want to help EMTs be prepared to act swiftly and confidently in these situations where naloxone administration is necessary. So in this package, we've put it together in a specific way, again, to help make that classroom management easier. So 4 students can simultaneously practice intranasal administration, while 10 can be doing that intramuscular injection simultaneously. So we've got all the things in the kit that students need for that hands-on practice. Then you can replenish your supplies easily with our supply pack. Now, Moulage is a fun and engaging way to get your students to buy into the realism of emergency scenarios. And all of our Moulage kits are made to adhere to mannequins or to people, so they're a great way to engage your students, again, creating more realism. And we have a brand new kit featured here, which is our Industrial Burns Kit. So we wanted to provide a low-cost, low-fidelity tool to create realistic, high-fidelity simulation scenarios. And studies have shown that there is a higher buy-in for students in simulation scenarios and greater outcomes when the realism is greater. So this is the type of tool that can help with that. And we work with a company whose genesis was in theater makeup, and their experience in creating realistic moulage wounds such as the burn kit is just excellent. They look and they feel very, very real. Now, these can be used on real people, where it could be students or standardized patients, or on mannequins. So it increases the flexibility for instructors on how they wish to set up a burn scenario. And the wounds are very, very durable. They can be used hundreds of times and never wear out because they're made of long-lasting silicone. No latex here. And there's an add-on, this can be used as an add-on module to the trauma wound simulation suit shown earlier in our presentation. We have several different injection trainers, a whole series of them, in fact, to help EMT students learn how to properly perform a variety of injections. Our large injection pad enables practice of intramuscular, intradermal, and subcutaneous. You can use fluids with it, and it has that 3 layers of the skin that are easy to clean up, dry out, and reuse. The small injection pad is a wearable for practice of intramuscular injections, and it's a great for extra practice of those soft skills such as patient communication. Now, the other simulators you see here teach intramuscular injections in the deltoid and buttocks areas. All of them provide real-time feedback if the injection is performed improperly or properly. Now, these are terrific classroom aids for students to learn how to use anatomical landmarks to locate the proper injection sites, depth, and angle. We have several soft skill programs available to you. We know that many of our products teach those hard skills of EMT, but we have employability skills program. The first one teaches 19 soft skills, and we also have a leadership soft skills program that teaches 18 more. Now, both of these are supplemental programs that could be used in any CTE program, including any EMT course. They're standalone programs that include step-by-step facilitator instructions, student workbooks, and scenario cards. And each lesson focuses on a different soft skill. Your students learn the skill and they learn to apply it in anywhere to 2 to 4 different activities within the lesson. We have worked with subject matter experts to create a series of EMT-specific scenarios that focus on those 19 soft skills in our employability skills program. Now, these work great as an icebreaker activity. It could even be a writing or a journaling activity, or a small or large group discussion. So all of the scenarios are real world scenarios focusing on a specific soft skill, and you read through it and solve the scenario at hand. Now, we referenced some pathway packages earlier, and we want to share those with you now. We have 3 different ones. They all provide comprehensive solutions for various EMS education levels. And these are especially helpful if you're wanting to start a program. So this is our EMR Pathway Package, and it includes all the items that you see listed on the screen in front of you. And it shows you a picture of the items as well, but there are 16 hours of course content ready to use in our EMR Pathway Package. Now, if you're going to do a more advanced program, here is our basic EMT Pathway Package. This includes more hands-on resources. So we have 12 different simulators and training kits that are a part of our basic EMT package. And again, you can see the picture of all of those on the screen as well for $14,999. And then our most advanced package is our Advanced EMT Pathway Package. And this has a ton of resources. It has over 38 hours of course content and lesson plans, integrating the use of over 44 hands-on resources. And some of them have multiple units. So you can see the long list of all of the items included in our Advanced EMT Pathway Package. Now, if you already have some of these items but are interested in others, we can create custom packages for you as well based on the needs of your program. So now what? Well, we have shown you a lot of our new tools specific to our EMT pathway. And if you are interested in any of them, you can go to realityworks.com, and there's more information about each of the products on the product pages. Some of them have short video clips, some of them have curriculum samples, and you could certainly go out to our the link that you also see in here for more information about all of our EMT products. So at this point, I would open it up for any questions that anybody might have on any of our products that we shared today. However, seeing no questions, I'm going to go ahead and wrap it up. But thank you for spending the time with us today to learn about the new tools that Realityworks has for your EMT Teacher Toolkit. We hope that you find these very exciting and very helpful in your programs, and we would be happy to answer any questions that you might have about any of them that we've shared today. Thank you.